Welcome to the module on Integrated Child Protection Scheme, ICPS. Learning outcomes of the module. The aim is to enable the learners to gain a basic understanding of the meaning of the concept of child protection, knowledge about the various services available for children under the Integrated Child Protection Scheme of the Government of India. The module provides overview of the juvenile justice system that deals with children who are in need of care and protection. It also intends to equip the learner with basic knowledge which is adequate to work within the juvenile justice system. The learner will be able to understand the salient features of the Integrated Child Protection Scheme. Meaning of child protection. Child protection is about protecting children from or against any perceived or real danger or risk to their life, their personhood and childhood. It is about reducing their vulnerability to any kind of harm and protecting them in harmful situations. It is about ensuring that no child falls out of the social security and safety net, and those who do receive necessary care and protection and support so as to bring them back into the safety net. While protection is the right of every child, some children are more vulnerable than others and need special attention. Child protection issues include violence in schools, child labor, harmful traditional practices, child marriage, child abuse, the absence of parental care and commercial sexual exploitation. The government recognizes these children as children in difficult situations and difficult circumstances, characterized by their specific social, economic and geopolitical situations. In addition to providing a safe environment for these children, it is imperative to ensure that all children also remain protected. Child protection is integrally linked to every other right of the child, and failure to ensure children's right to protection adversely affects all other rights of the child. In early 2006, the Department of Women and Child Development became full-fledged ministry, and the following child protection matters were transferred to the new ministry: Implementation of Juvenile Justice, Care and Protection of Children Act 2000 and its Amendment Act 2006. Implementation of various programs, including an integrated program for street children, Childline Service, Scheme for Assistance to Homes for Children, Shishugra, to promote in-country adoption, Scheme for Working Children in Need of Care and Protection, CARA. This was a significant step towards consolidation of the child protection portfolio under one ministry. The need for Integrated Child Protection Scheme, ICPS. India is home to almost 19% of the world's children. More than one-third of the country's population, that is around 440 million, is below 18 years. It is estimated that around 170 million or 40% of India's children are vulnerable to or are experiencing difficult circumstances. The neglect of child protection issues results in outright violation of the rights of the children and increases their vulnerability to abuse, neglect and exploitation. Therefore, there was an urgent case for increasing expenditure on child protection so that the rights of the children of India are protected. Integrated Child Protection Scheme. A close examination by the Ministry of Women and Child Development of existing child protection schemes has revealed major shortcomings and glaring gaps in existing child protection institutions, policies, programs and their implementation at all levels. The minimal government structure that exists is rigid, and a lot of time and energy are spent in maintaining the structure itself rather than concentrating on programmatic outcomes. The ministry realized that the existing programs and schemes are marked by the following limitations, which are outlined here. Deficiency in mechanism for prevention. Policies, programs and structures to prevent children from falling into difficult circumstances are mostly lacking. This pertains to both policies to strengthen and empower poor and vulnerable families to cope with economic and social hardship and challenges, and thus be able to take care of their children, as well as to efforts to raise awareness of all India's people on child rights and child protection situation. Lack of planning and coordination. Poor implementation of existing laws and legislations. Lack of linkages with essential lateral services for children, for example, education, health, police, judiciary, services for the disabled, etc. No mapping has been done of the children in need of care and protection or of the services available for them at the district, city, state levels. Lack of coordination and convergence of programs or services. Weak supervision, monitoring and evaluation of the juvenile justice system. Insufficient services relative to the needs. Most of the children in need of care and protection as well as their families do not get any support and services. Resources for child protection are meagre and their utilization is extremely uneven across India. Lack of services addressing the issues like child marriage, female feticide, discrimination against the girl child, etc. There is very little intervention for children affected by HIV/AIDS, drug abuse, militancy, disasters both man-made and natural, abused and exploited children, and children of vulnerable groups like commercial sex workers, prisoners, migrant population and other socially vulnerable groups, etc. No sufficient intervention for children with special needs, particularly mentally challenged children. Inadequate infrastructure. Structures mandated by legislation are often inadequate. Lack of institutional infrastructure to deal with child protection. Inadequate number of CWCs and JJBs. Existing CWCs and JJBs not provided with requisite facilities for their efficient functioning, resulting in delayed inquiries and disposal of cases. Lack of adequacy of human resources. Inappropriate appointments to key child protection services leading to inefficient and non-responsive services. Lack of training and capacity building of personnel working in the child protection system. Inadequate sensitization and capacity building of allied systems including police, judiciary, healthcare professionals, etc. Lack of proactive involvement of the voluntary sector in child protection service delivery by the state UT administrations. Large number of vacancies in existing child protection institutions. Major gap in services. Inappropriate use of institutions in contravention to government guidelines. Lack of support services to families at risk, making children vulnerable. Overbearing focus on institutional residential care with non-institutional, that is non-residential services neglected. Interstate and intrastate transfer of children, especially for their restoration to families, not provided for in the existing schemes. Lack of standards of care, accommodation, sanitation, leisure, food, etc. in all institutions due to lower funding. Lack of supervision and commitment to implementation and monitor standards of care in institutions. Most 24-hour shelters do not provide all the basic facilities required, especially availability of shelter, food and mainstream education. Minimal use of non-institutional care options like adoption, foster care and sponsorship, etc. to children without homes and family ties. No mechanism for child protection at community level or involvement of communities and local bodies in programs and services. Lack of rehabilitation services for older children not adopted through the regular adoption process. Aftercare and rehabilitation program for children above 18 not available in all states, and where they do exist, they are run as any other institution under the JJ Act 2000. Weak accountability, monitoring and evaluation. Reporting mechanism and accountability are not clearly defined and are rarely enforced in most of the programs and schemes. Monitoring mechanisms are not in place. Data required for planning, policy making and monitoring is not available. Evaluation is rarely done. With a view to mitigate limitations listed above, the Ministry of Women and Child Development, Government of India, introduced the Integrated Child Protection Scheme to contribute to the creation of a system that will efficiently and effectively protect children, minimizing the gaps in services. It is based on the cardinal principles of protection of child rights and best interest of the child. The ICPS aims to bring together multiple vertical schemes under one comprehensive child protection program and integrate interventions for protecting children and preventing harm. The ICPS was approved for implementation on 26th February 2009. Aims and objectives of ICPS. The ICPS aims to institutionalize essential services and strengthen structures through the following objectives. Establish and strengthen a continuum of services for emergency outreach, institutional care, family and community-based care, counseling and support services. Put in place and strengthen necessary structures and mechanisms for effective implementation of the scheme at the national, regional and state and district levels. Define and set standards for all services, including operation manuals for the functioning of statutory bodies. The broad objective of ICPS is to contribute to the improvements in the well-being of children in difficult circumstances, as well as to the reduction of vulnerabilities to situations and actions that lead to abuse, neglect, exploitation, abandonment and separation of children. Target groups of ICPS. The ICPS focuses its activities on children in need of care and protection and children in conflict and contact with the law, namely child in need of care and protection, which means a child who is found without any home or settled place or abode and without any ostensible means of subsistence. Child resides with a person, whether a guardian of the child or not, and such person has threatened to kill or injure the child. Child is mentally or physically challenged or ill child, suffering from terminal disease or incurable diseases, and or having no one to support or look after him or her. Parent or guardian of the child is unfit or incapacitated to care for or supervise the child. Child who does not have a parents, and no one is willing to take care of him or her, or whose parents have abandoned him or her, is being or is likely to be grossly abused, tortured or exploited for the purpose of sexual abuse or illegal acts, is vulnerable and is likely to be inducted into drug abuse or trafficking. Child likely to be abused for unconscionable gains. Victim of any armed conflict, civil commotion or natural calamity. Child in contact with law. The ICPS is also mandated to provide preventive statutory care and rehabilitation services to any other vulnerable child, including but not limited to children of potentially vulnerable families and families at risk, children of socially excluded groups like migrant families, families living in extreme poverty, scheduled castes, scheduled tribes and other backward castes, families subjected to or affected by discrimination, minorities, children affected and infected by HIV/AIDS, orphans, child drug abusers, children of substance abusers, child beggars, trafficked or sexually exploited children, children of prisoners, street children and working children. ICPS programs and activities. Every child of India has the right to be cared for by a loving and nurturing family, to live with dignity and to be protected from separation from his or her family, violence, abuse, neglect and exploitation. Through ICPS, the Government of India envisages to carve out a broad and comprehensive framework for child protection in the 11th plan and to set the foundation for creating a strong, protective environment for children. ICPS brings several existing child protection programs under one umbrella and initiates new interventions. The ICPS is designed to focus on the following: mapping needs and services for children and families at risk, preparing child protection plans at district and state levels The plan would be gradually extended to the block and community levels. Strengthening service delivery mechanisms and programs including preventive, statutory, care and rehabilitation services. Improving access to and quality of services provided. Promoting and strengthening non-institutional family-based care options for children deprived of parental care, including sponsorship to vulnerable families, kinship care, in-country adoption, foster care and inter-country adoption in order of preference. Developing capacity of service providers. Strengthening knowledge base, awareness and advocacy. Establishing an integrated live web-based database on children in difficult circumstances. Children in care, service providers and service provided. Monitoring and evaluation. Building partnerships and alliances for child protection at all levels, particularly at the grassroots, community and district levels. Strengthening linkages with other bodies and institutions such as the National State Human Rights Commissions and National State Commissions for Protection of Rights of the Child, etc. Care, support and rehabilitation services under ICPS. Emergency outreach services through Childline, open shelters for children in need in urban and semi-urban areas, family-based non-institutional care through sponsorship, foster care, adoption and aftercare, institutional services. Institutionalized services consist of shelter homes, children's homes, observation homes, special homes, specialized services for children. Statutory support services for children under ICPS programs are child welfare committees, juvenile justice boards, special juvenile police units, child tracking system. Child tracking system. The child tracking system will be set up by the Central Project Support Unit under the ICPS. The CPSU develops uniform data entry mechanisms and unified procedures for enabling centralized coordination through effective use of web-enabled software that will be developed for the purpose. At the state level, SPSU and SCPS with support of District Child Protection Society will set up and manage this child tracking system. The child tracking system of ICPS will have two components: web-enabled child protection management information systems, national website for missing children, a systematic and centralized mechanism for tracking missing children. Summary of this module. In this module, the learner got an opportunity to understand basic understanding and meaning of the concept of child protection. It also enables the knowledge of the learner about the various services available for children under the Integrated Child Protection Scheme of the Government of India. The module also provides an overview of the juvenile justice system that deals with children who are in need of care and protection. Thank you for attending this session.